What do the numbers on a CBC report mean? Imagine peering into a tiny snapshot of your blood and discovering what it reveals about your health. That's what a complete blood count report does. It's a vital test that helps doctors understand how your blood cells are functioning and can point to conditions like leukemia. The report provides several key numbers, each telling a part of the story. First, there are white blood cells, or WBCs. These cells are your body's defenders, fighting off infections. When a doctor looks at your WC count, they check if it's too high or too low. A high WC count might suggest your body is fighting an infection or that there could be leukemia, which often causes an abnormal increase in these cells. On the other hand, a low WC count, called leukemia, can mean your immune system is weakened, possibly due to leukemia or the effects of treatment. The report also breaks down specific types of white blood cells, like neutrophils and lymphocytes. Low neutrophil levels, known as neutropenia, can make you more vulnerable to infections. Low lymphocytes can impair your immune response. In leukemia, the presence of immature or blast cells in the WC count is a key indicator, as these abnormal cells are often seen in the blood. Next, we look at red blood cells, or RBCs. These cells are responsible for carrying oxygen throughout your body thanks to a protein called hemoglobin. When RBC levels are low, it's called anemia, which can cause fatigue, weakness, and shortness of breath. Leukemia can cause anemia because the disease or its treatment can interfere with red blood cell production. Sometimes, RBC counts can be high, but this is less common and can increase the risk of blood clots. Hemoglobin, the oxygen-carrying protein in RBCs, is another important number. Low hemoglobin levels also point to anemia and can make you feel tired and weak. Hematocrit is the percentage of your blood made up of red blood cells. When hematocrit is low, it confirms anemia, meaning your blood has fewer red cells than normal. Platelets are tiny cells that help your blood clot and stop bleeding. If your platelet count is low, a condition called thrombocytopenia, you might notice easy bruising, bleeding gums, or frequent nosebleeds. This is common in leukemia because the disease can disrupt platelet production. Conversely, a high platelet count, or thrombocytosis, can increase the risk of blood clots, which might lead to heart attack or stroke. In leukemia, the CBC often shows a mix of these abnormalities. You might see very high or very low WC counts, low RBCs, low hemoglobin, and low platelets. These changes help doctors identify leukemia, determine how severe it is, and monitor how well treatments are working. Normal ranges for adults vary but generally are about 4.2 to 6.1 million red blood cells per microliter of blood, 4,500 to 11,000 white blood cells per microliter, 150,000 to 400,000 platelets per microliter, hemoglobin levels from 12 to 18 grams per deciliter, and hematocrit from 37 to 52%. Understanding what these numbers mean helps doctors distinguish leukemia from other conditions and decide what further tests are needed. Additional tests like blood smears or bone marrow biopsies look at cell shape and structure to confirm the diagnosis. Remember, a CBC is a crucial first step in diagnosing and managing leukemia. It shows how the disease and its treatments affect your blood cells. But always keep in mind that these results need to be interpreted by healthcare professionals who consider your symptoms and other tests to give you the most accurate picture of your health. If you have concerns or symptoms, consult your doctor for personalized advice.